Alaikum. Good evening, everyone. Welcome to our webinar. My name is Hissa Al-Bhejan. I'm pharmacist and I'm senior scientific evaluation expert in Saudi FDA. We'll be hearing today a presentation from Dr. Bushra. She'll be speaking to us about the artificial intelligence and medication safety. Let me talk about Dr. Bushra a little bit. Dr. Bushra is an AI advisory and planning at SDAIA. SDAIA. She has more than 2 years of experience as a business specialist at SDAIA. She contributes to the development and the implementation of data and artificial intelligence policy and strategy for the healthcare sector. Dear participants, kindly notice that the questions will be at the end of the session and posted in the question and answer icon. So our speaker will answer them gladly. Now, moving along to our session, please welcome Dr. Bushra to deliver the presentation on this very timely subject.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Dr. Hissa, for this honoring introduction. And adding to what you said about my experience, I have a full of 7 years experience related to inpatient pharmacy, clinical pharmacy, and inpatient safety specialist, and then at SDAIA currently. I'm super happy to have this opportunity and to meet with our dear colleagues and friends from all over the globe. Inshallah, this session will meet your expectations and hopefully find it remarkable and hard to forget. For today's agenda, we will start with a brief introduction to understand the concept of AI and review fundamental concepts of medication safety. Then we will see a practical application of AI technologies, specifically in medication safety. And of course, with implementing this technology, we will face some challenges. But we will come over these challenges by taking some consideration into account, and it will lead us to a better solution and better implementation techniques. Then I will ask you to jump with me and take a leap to the future to see how AI in healthcare is expected to be, and we will conclude that into a 2 minutes video. And there is a surprise. I need you to keep up with me until the end to see this surprise regarding the video. And then it will be 15 minutes open for your discussions, comments, and sharing thoughts. So please, I'm asking you to gather your thoughts during the presentation and keep it for the 15 minutes at the end to have the webinar as fruitful as we can. Moving to an introduction. Can you see I guess there is a problem. Yeah. AI is a trendy word that everyone, you hear him talking about AI. Either an entrepreneur starting his new business and he wants to integrate the AI in his business, or a healthcare provider that he wants to succeed and achieve a best practice in his field, or mainly in the technology industry. Everyone keeps saying AI, artificial intelligence, and AI. If we want to know what does it mean, we should look at the definition of AI. Stuart Russell and Peter Norweg, in their widely used textbook titled Artificial Intelligence, A Modern Approach, defined AI as a branch of computer science that focuses on creating systems, machines, or software programs capable of performing tasks that typically require human intelligence. These tasks include problem solving, learning, reasoning, understanding natural languages, receiving and interpreting sensory data, and making decisions. The main aim for AI is to simulate and replicate human cognitive processes in machine, enabling them to process information, adapt to changing situations, and perform a wide range of tasks autonomously. When we say artificial intelligence, we are talking about technology. So what kind of technology is adopting in AI? There is a lot of technologies, but the main four or the major four technologies, and we hear about a lot, especially in healthcare, is machine learning, deep learning, computer vision, natural language processing. So if we want to define machine learning, so we don't want the term to come us and by us and pass us without understanding what does it mean. So machine learning is a subset of AI that focuses on developing algorithms and models that allow systems to learn from and make prediction or decision based on a huge amount of data. While when we talk about deep machine learning, it involves neural networks with multiple layers and deep technical details that we are not going through. We will just keep it superficial and something we can understand. So when someone comes to us and say deep learning, we can know what does it mean. Deep learning also shown a remarkable success in healthcare, especially in text, like images and speech recognition. Computer vision, it allows the machines to interpret and understand visual informations from images and videos. It's used in facial recognition, autonomous vehicle, and medical images analysis, and we see it in multiple solutions. And the last one is NLP, which is natural language processing, which is a branch of AI that deals with the interaction between computers and the human languages. The simple example about that is the customer service we see currently in chatbot. When you send him a message and a robot is replying to you, this is mainly using NLP techniques. As I mentioned before, there is a lot of examples in AI technologies. And when we use these technologies, we customize it in a different industries. For example, in healthcare, we customize it in medical imaging. We customize it in replying to customer or to patients through chatbots. To answer a question why we use AI in healthcare, because human life always matters. And every successful and considerate healthcare provider is always seeking a better ways to practice, better and safer. We don't forget about safe practice. AI abilities can support diagnostic decision, which lead to less misdiagnosis patients, early prediction for serious diseases, which lead to early intervention and saving lives. In pharmacy-related practices, there is a lot of strength area we can implement AI technologies on. For example, medication reconciliation, drug-drug interaction, detection of medication adherence, and adverse events. We will take each of these areas in details when we proceed in this presentation. After a comprehensive introduction I gave you about AI and the definition of AI, the concept of using AI and what will help us in healthcare, let's refresh our mind with the 6 concepts of medication safety and why it's crucial in healthcare settings. And how it relates with AI by using these AI technologies in these areas. So, rule of thumb for any healthcare provider is do no harm or preventing harm. How are we going to prevent harm? Introducing AI technology definitely will reduce errors, human errors. And also it will enhance overall patient safety. For the second concept, which is patient well-being, we make sure in this concept that the overall health of the patient and the quality of life is well managed. What do we mean about quality of life, we mean the life the patient is living. Is it satisfied or need to be improved? Using AI for early prediction of renal failure, for example, and early dose adjustment to prevent patient deterioration. So we keep the overall patient well-being on track and on a satisfied baseline. Quality of care is the third concept, and quality is a broad, wide term, including standards and fundamental to be covered to ensure that the patient receiving the best care from a quality perspective. How can AI help in this concept? By detecting and preventing medication error, by analyzing medication orders and patient records to identify potential error, such as incorrect dosage, drug interaction, or allergic before they even reach the patient. How about patient trust? Patient trust is the fourth concept of medication safety. And when we improve this concept, we are not only talking about medication safety, but we will talk about the health the health of the patient overall. So when we implement AI technology, is intended to enhance the accuracy of diagnosis and the accuracy of the treatment plan, we can directly affect the patient trust in a very positive way. Regulatory compliance. Regulatory compliance and following the policies and the regulations can all lead to a better healthcare services. How AI can help in this? AI can assist in automating and ensuring compliance with healthcare regulations. And the targeted audience for this implementation of AI technology, when we talk about the organization who is monitoring these regulations and policies and implementing them, and how the standards are implemented in the healthcare organizations. This will reduce the risk of non-compliance and associated penalties. For the last concept is public health impact. By implementing the best practice with high standard and support your practice with latest technology, you will impact the public health positively, reducing the mortality rate, reducing the prevalence of chronic diseases, and the treatment cost, and say you eventually will save life. So after all of these concepts, we will examine real-world case studies and future trends, shedding light on how AI is not only advancing medication safety, but also contributing to the overall improvement of a healthcare quality and patient outcome. So are we good so far? Or you hear me good, Hissa? Everything is fine? Good. So let's see the practical application of AI in medication safety. So as you see here in this slide, these are the areas of improvement in medication safety. These areas represent painful problems to the healthcare providers and especially to the pharmacists. Let's take it one by one. So first one is medication reconciliation. Medication reconciliation is a major concern to any pharmacist. Even for me, when I was practicing, medication reconciliation is a huge headache. We want to match the patient, what medication the patient is taking currently, what the patient is taking before, what kind of herbal medication he's taking, and what kind of supplement he's taking. And we're trying to match all of these to make sure that there is no duplication, there is no missing dose, and compare it to the new prescribed medication, especially in case of patient is admitted to the hospital. So this area of medication safety concerns showing a promising solution using AI. How about the second area, drug-drug interaction? In the daily practice in the hospitals, we see softwares that you can enter the name of the drug and the other drug, and you compare between each other. And they said, it's green, you can go ahead, you can prescribe both. Or it says yellow, you should be considerate or you should be cautious. Or red is completely interaction and completely dangerous to use them together. But what if the pharmacist or if the physician or if whoever involved in this process missed to check, or the software itself missed to check these two drugs interaction? This is a huge concern for the medication safety. But when using AI, we can use AI here, and it goes and investigates into each medical record the patient have, look into his medication list, and he can figure it out, the drug-drug interaction, without being without being writing it down by the pharmacist himself or by checking manually. The medication adherence, the third one, and the monitoring is also an area of concern due to its complication on the patient. Using AI can help in analyzing the pattern that the patient is taking the medication or not. We saw a lot of patients coming to the clinics. His HbA1c is not reducing while he is on insulin-regulating medication. First thing come to our mind is that he is not adherent to the medication. And when we ask him, he said, no, I take my medication. I'm every 3 times, every 2 times, but the HbA1c is saying the other word. We can investigate a lot of things. We can investigate his lifestyle, his diet. But if we saw everything is fine, then it comes to our mind that he might not taking the medication on time and sometimes with wrong dose. How are we gonna interpret this information? We can interpret it by using Internet of Things. And this is a very, very a promising future trend that we will discuss it later in this presentation. How are we gonna enhance the medication adherence? The last area of concern for medication safety is the adverse events. It is a concern. Why? As most of us know, it is because of health consequences. So predictive analytics of adverse event using AI to analyze historical data, including patient demographics, medical history, laboratory value, medications he's taking now, and other variables that are relevant to the prediction of adverse event. For a human, it's hard to go and investigate all of these documents. And sometimes also the document itself doesn't contain all of these information. But AI can look at all of this, and from multiple training and multiple data, he can predict the adverse events, even if the information is not included. In these slides, or in these upcoming slides, we will discuss examples of AI application can be used to overcome some problems related to the medication safety. As we can see here is custom reminder of the time that the patient will take his medication. As I mentioned before, one of the concerned area or area of concern in the medication safety is adherence, medication adherence. So an AI application could track patient medication adherence through connection or connecting with a smart medication dispenser, wearables, or patient-reported data. I saw, like a couple of days ago, I saw a smart box that when the patient is opening it, it starts to sense if he is taking the pills or not and reporting it to his medical record. This is a very advanced technology, and it will relate to the enhancing medication adherence. This is an automatic dose optimization. As we all know, as a pharmacist and even physicians and other healthcare providers and nurses, for example, they know that if the patient having a kidney problem or renal problem, we need to optimize this dose. Also, if the patient is a child, we need to optimize the dose and we need to figure it out what dose he will take. This calculations could be happened manually, and there is a huge margin of error for these calculations. But using AI algorithms can calculate the optimal dosage of drug for each patient, taking into account their unique characteristic and response to medication. Even the response to the medication will be taken into account, which is hard to monitor and to know by human behaviors. Automated dispensing systems. I think most of us see, not most of us, at least the hospitals that are adopting high technology, adopting this kind of technology, which is automated dispensing systems. I see it myself. And it is very huge solution and huge pain relief for the pharmacist, especially who is working on unit dosing. Because unit dosing, you have to calculate the dose and how many pills you're gonna give to the patient by the number of days and by the number of doses he's taking. So automated dispensing systems, one of the examples of AI application. And I saw recently, some of the machines are enhanced by NLPs that can read the prescription and can immediately dispense the medication. Of course, we need a pharmacist to validate the outcome and the number of medication that came out of this automated dispensing systems. But a huge routine part of the pharmacist is taken away, and let the pharmacist focus on the most important thing, which is the patient and how we're going to deliver the medication in the right dose, right time, and to the right person. Pharmacovigilance, one of the concerns to the organization. And it is very interesting area for regulatory organization. And the ability of AI to analyze vast majority and large number of data set to detect adverse effects from different resources. For example, from reports from public people, they report some adverse effects they had from a medication. Using AI can collect all of these type of data and they can report it to this organization. The last example is the drug discovery and development. And this part, we will discuss it also in the future trend because a lot of things coming up in the future related to the drug discovery and development. But I think most of us know and hear about using AI model that can generate you any image, you write it down. Like ChatGPT and other tools you can use, you write them that you want a video, you want an image, and you just describe it, and the AI will generate it for you. Currently, there is a lot of work being doing to generate models that help the scientists to structure the pharmaceutical component of pharmaceutical products, which will lead to a revolutionary innovations in pharmaceutical industry. Actually, when I was preparing this material for this presentation, I found out that AI models were used for some vaccine used in COVID-19. It was very surprising for me because they use it specifically to predict potential antigen candidate and protein structure for the COVID-19. And also, these structures are very important to define the effectiveness of vaccines. Also, there is two programs or AI models, DeepMinds and AlphaFold, was used to predict protein structure, which assist in vaccine designing. That leading to reducing time, effort, and save us from a horrible pandemic. It was very impressive for me. After all of these comprehend examples, what are we expecting from, what benefits we are expecting from implementing AI in medication safety areas? And I'm inviting you to see and let the number talks now. The World Health Organization stated that medication errors affect an estimated 1 in 10 patients worldwide. What will happen if we implement, or what happened already when we implement AI technologies to reduce this problem? Studies stated that AI can significantly reduce medication error, which are a leading cause of patient harm. How about the adherence to medication, which I told you before, and we mentioned it in the beginning of this presentation, that medication adherence is one of the huge problems. So in Saudi Arabia, they estimated that the adherence to the medication is 50 to 70%, that patients are not taking their medication as prescribed. How the technologies help? Studies have shown that medication adherence apps can improve adherence by 27.3%. How about if we use the Internet of Things? As I told you, it's a future trend. We will see it and we will explain it later on. I'm 100% sure we will see a doubling in this percentage. 12% of all medication error in Saudi Arabia were related to prescription error, and 51 million prescription error occurred annually in the United States. And there is a study published in JAMA, which is a very reputational journal, found that an AI-powered system reduced the rate of prescribing errors by 50%. And 50% is a really, really good number. It means by half we reduce the prescription error. So if we want now, we talked about the benefits, and I'm 100% sure that every one of us attending this webinar is convinced that we need AI technologies in medication safety and in healthcare overall. But what challenges and what consideration we need to see and we need to overcome and we need to take into account? So there is a lot of challenges, to be true with you and to be honest, but these are the most 4 challenges we faced from the practice in AI. The first one is the data quality and accessibility. When we talk about AI, we talk about data that will feed the machine. If the data is good, if the data is standardized, it's in high quality, and it's consistent, we will get a very accurate model and it will deliver the outcome we want. But if the data is fragmented and inconsistent or stored in a various format, we will definitely have a problem with the model and with the outcome from the model. How are we going to overcome this challenge is by establishing data governance practice to improve data quality and to standardize the quality to ensure compliance of data privacy regulations, especially we are dealing with patient data. How are we going to protect their privacy, confidentiality, and security? And in Saudi Arabia, we have a lot of regulations and rules and principles talking about and considerate regarding the data privacy and sharing. The second one is the algorithm bias and fairness. As we said, that based on data we feed the machine on, we will get the model we want or the outcome we want from the model. Sometimes the bias is related to the programmer, sometimes the bias is related to the data. So these algorithms will inherit the bias, especially in the training and the more technical details that my colleagues in the computer science and in the AI engineers more advanced than me, but this is what I heard from them. So it will give you a biased recommendation after all, and it will give you a biased decision after all. So it needs to be contained. So for the sake of containing this bias and maintaining fairness in these algorithms, we need to regularly assess and audit AI algorithm for bias and implement fairness-aware machine learning techniques to mitigate bias and ensure equitable medication recommendation. The third challenge we are facing is the clinician acceptance and training. And I can guarantee you that everyone and every colleague I have, when we talk about the AI models and the technology in healthcare, they always reply to me saying, you are going to replace our jobs. You don't want us to work. You're going to implement machines and do that and did that. And I always say to them, we cannot replace you because we need you. We need your inputs. We need your collaboration. We need your verification. We need your validation. We cannot count on machines always. So we always find some resistance from the clinicians and the healthcare provider. And I don't blame them because sometimes you need to understand what is the technology. And I've witnessed it many times that when they are convinced, they adopt it and they become advocate for it, and they are trying to implement it in every unit in the hospital or every part of the hospital. So that always the healthcare professionals could be skeptical or unfamiliar with AI tools. And also we are facing some challenges with the training. We have limited knowledge about AI, especially because AI is a new technology. It's a new thing. And when we want to train people on new things will be updated, and we have to keep up with these updates. So how we overcome all of these challenges regarding the clinician acceptance and training? By providing a comprehensive training and by providing them updates regarding the AI and show them the benefits and show them how we'll make it the focus of the healthcare provider on the main part or main important part in their daily job. Last one, but not least, of course, is the cost and resource constraints. When you implement an AI technology, definitely will be costly and will be expensive. How are we going to overcome this is by doing cost-effective analysis, return on investment, and we analyze and we understand if we implement this technology, how many patients we're going to save, how many cost in the human resources, in the money-wise, how we're going to save, how much we're going to save, and how much we're going to return if we implement this AI technology. Okay, so let's take a glance about future trends. What will be the shape of healthcare services in the future? I think I gave you some hints during the presentation, but let's see the first one. First one is like a dream for everyone, is integration with electronic health records. The integration of artificial intelligence with electronic health records represent a significant and promising future trend in healthcare. Why? Because once the different AI models with different AI expected outcomes are implemented directly to each patient health record, it will make it faster and easier and safer to do the decisions. Such as I mentioned before, the dose optimization, looking into the medical record, looking into the medication adherence, all of that can be happened in one session. And that's amazing if happened. The second one is the wearable and Internet of Things. I'm sure that you heard me saying a lot of Internet of Things. Internet of Things is a technology that's mainly based on sensors around you in a specific area. So Internet of Things is a promising future trend with the potential to significantly improve the patient outcome, medication adherence, and healthcare efficiency. For example, one of the examples I mentioned it before is the smart pill bottle or blister bags. These blister bags or pill bottles can send reminders and alert the patient when it's time to take their medication. And even if they're missing it or not taking it, it can give a hint or a note in his medical record, and the physician and the healthcare provider can notice it and track it. The last one is this is my favorite actually. This one, like I'm seeking to see it one day, is AI driven drug discovery and personalized medicine. And for sure, and for indeed, it is the future trend that holds significant promises in the field of healthcare. This trend is expected to be reshaping the pharmaceutical industry, especially when we talk about genomics. Genomics and the proteomics coupled with AI allow the physician and nurses and the healthcare provider to individualize the medication based on the unique patient genetic makeup. Based on your genetics, based on your information, I can treat you, I can give you a treatment plan. And that's really a huge thing, waiting for it to be happened. In conclusion, I'm inviting you to take these 2 minutes watching a summary video of what we elaborate and discuss during the webinar. And you remember that I mentioned by the end of this presentation, you're gonna see a surprise thing. So I need you just to refresh your mind and keep focusing on the video, and I will hear it from you, or maybe I will tell you.
Books an appointment with a virtual specialist. The AI system also provides guidelines on lifestyle changes.
Can you start it from the beginning, please?
Jane can take to manage her situation. Could this be the future of healthcare, where artificial intelligence takes an active role in our health decisions? This story is hypothetical, but the technology is real and developing rapidly. Artificial intelligence has the potential to revolutionize healthcare in ways we can only imagine today. AI can provide accessible healthcare solutions, particularly in remote areas where medical facilities are scarce. It can help in early detection of diseases, even before the symptoms become severe. It can sift through vast amounts of medical data and literature to provide accurate diagnoses, something that would take a human physician a significant amount of time. Furthermore, AI can provide personalized healthcare. It can track a patient's health in real time, predict potential health risks, and suggest preventive measures tailored to the individual's lifestyle and health condition. But perhaps the most significant potential of AI lies in its capacity to learn and improve. With every case it encounters, the AI system becomes more accurate, more efficient, and more knowledgeable. In conclusion, artificial intelligence holds immense potential in transforming healthcare. From providing accessible healthcare to early detection of diseases, from personalized healthcare to continuous learning and improvement, AI is set to redefine the future of healthcare. Imagine a future where every Jane has access to immediate, accurate, and personalized healthcare, right at her fingertips. That's the future artificial intelligence promises, and it's a future worth striving for.
Okay. Can you hear me now?
Yes.
Yes, good.
Yes.
So I would like to drive your attention to know that this video is completely generated by AI. The voiceover that you heard, the script you heard, the motion you see, the music you heard, all of that was generated by AI. I just write it down. I wrote, I want to sum up my presentation, and this is the video the AI generated for me. So thank you for listening, and please feel free to ask any questions and share your comments and thoughts. The panel is yours now. Thank you so much.
Thank you very much, Dr. Bushra, for addressing this interesting topic. Very impressive. Dear participant, can you please post your questions in the questions and answer icon? So our speaker will answer them gladly. To start, before we receive any, until we receive more questions, I'd like to ask you a question, Dr. Bushra. So as a pharmacist, as you have mentioned, there are lots of data, and we are working really hard into going into implementing AI in lots of our operations in pharmacy. So whenever we meet with the IT people and tell them about our ideas, we find out that no, this is not an AI idea, it's programming or based on other statistical methods. Can you please give us a small differentiation between AI and other technologies?
Thank you so much. This is a great question, actually. Yeah, there is a difference between AI technologies and other technologies rather than the AI. For example, like using statistics, using data, and based on that data analysis, we came up with decisions. This is a bit different than AI. When we talk about AI, as I mentioned in this presentation, we talk about computer vision, we talk about machine learning, we talk about deep learning, we talk about neural natural language processing. When these technologies are integrated with your solution, so we can say it is an AI solution. Rather than that, we cannot say it's an AI solution. We can say it is a technical solution, especially when we say data analysis and when we have Excel sheet and we came up with the highest percentage of or highest cost medication in the hospital and a platform that show me which medication is out of stock, which is not. So this is basically data analysis rather than AI technology per se.
Thank you. This is very clear. We have one more question from our audience, from Lena. Lena is asking, how does artificial intelligence serve to develop medical field, in specific in radiology?
Mainly from the practice, we saw computer vision. Computer vision is very, very involved and very developing in this area, specifically in radiology. Because computer vision, we try to teach the machine to read the image and to classify the image. For example, like the breast cancer, if they say if the machine saw the mammogram or the model saw the mammogram, it can detect if there is if this is a suspicious tumor, if it's not. So basically, what I saw from the practice is the computer vision, which is highly implementing in the radiology area.
Thank you. And as you, Dr. Bushra, working for the main authority for the AI in the kingdom, can you please just give us some information about the extent of AI implementation in the healthcare sector in the kingdom?
Yeah, actually, we have set with our ecosystem, with our hospitals, and with our partners from different sectors in the healthcare. And we try to define the areas that are the most painful areas to the ecosystem. And we try to put the solutions. And it's currently in a progress to develop some solutions and to develop these solutions and to implement them. And we are facing some challenges, as I mentioned, with the data quality, with the data, with the training, with the resistance with some of the healthcare providers. So this is mainly what we saw in our practice.
Thank you very much. It appears that we have one more question. So Yumna from the audience is asking that who's responsible for introducing the AI topic in any organization, and who's responsible for educating and training the healthcare staff on how to use AI tool effectively?
Does she mean that within SDAIO or?
I mean, I believe she meant within the organization, within the healthcare institution itself. So which department?
Basically, is the training and development in each organization, like the hospitals and like that. From what I know, they are responsible for the development and the training of the staff. So mainly, it's that way.
And our final question for today from Hiba Al-Harbi. Will there be a need for pharmacists with applying of artificial intelligence?
Sorry, I couldn't catch you. What did you say?
The question is, after the application of the artificial intelligence in the healthcare, will there still be a need for pharmacists to be practicing in the field?
Of course there is. Yeah, of course there is. We cannot depend on the machine. Let's say that the internet is down. There is no computers anymore. Let's assume that there is something wrong happened with the model. Who's gonna report it? How are we gonna work? Of course, we need pharmacists. We cannot replace the healthcare providers. We can help them. We can assist them. We can help them with the routine work to let them focus on the main thing, which is the patient. So if the pharmacist is occupied by preparing the medication and then validation and then administering dispensing the medication, and then with a lot of orders during the day. But if we give the machine a little bit a part of routinic cyclic work, so it will be easier for the pharmacist to focus on delivering the right dose, the right medication for the right person. I'm sorry, I can't express how I'm frustrated with this argument. We cannot replace any healthcare provider. We need you there.
Thank you very much, Dr. Bushra. So on behalf of the Saudi Patient Safety Center, we would like to thank Dr. Bushra Al Khalifa and the audience for their active participation. As a part of the Saudi Patient Safety Center's effort to provide you with the timely topics and interesting speakers, we'd appreciate it if you would fill out the evaluation survey provided at the end of the session. Thank you for joining us today, and we would like to forward to welcoming you back in the future webinars. Thank you very much, and thank you very much, Dr. Bushra.
Thank you so much. I hope you find this webinar as expected to be. And this is my personal info, and you are very welcome to reach me at any time. Thank you so much.